Because it's next.
Oh, yeah. Jake, come take this dog. Go. Go. Go see mama. Go see mama.
I can see it. Okay. See it.
Okay, you were live on Channel 8 and YouTube. I apologize for the delay.
Okay. We're trying to see if we can get it. Okay. All right. So we can start the meeting at 8:04. Just Earl and Laura, if you had time to look over the minutes from September. Were there any questions?
Nope, all set.
Okay, that was easy. So somebody can make a motion to approve those.
I'll make a motion.
I'll second it.
Okay, so Lori, you, COVID-19 updates, which thank you for giving those all to us every week. Keeping everybody informed.
There's just a couple of things, subjects to cover. Earl had brought one up with regard to how do you report, what do you report, close contacts, things like that. So the simple part is if you think you have symptoms or you think you want to be tested for COVID, you can actually go to the website and we have a link through the report, or you can go to Mass DPH. Once you've been tested, if you're positive, the reporting's going to happen for you. You'll be contacted by a contact trace person, whether that's our public health nurse from MPHN or the Contact Tracing Collaborative, which is an entity that came together through the massive need because of all of the positive test results. It's unfortunate, but they've been pretty good too. So the reporting will happen naturally, but anytime you have a question, you can call the office anytime. I'm happy to answer whatever I can. There is no shame in contracting COVID-19. I mean, it's a very virulent coronavirus that is easy to pick up. Just, you know, it's unfortunate. The school has gone to fully remote through the end of the year. That was a decision that was made today. The close contacts is what really does them in. I believe they had 2 positive cases, but with the amount of people that came in contact at the middle and high school, they felt abundance of caution and have gone to fully remote. The elementary school right now is still open. Neither of the schools have, there's no transmission so far within the schools. It's all outside and trying not to have it be transmitted in school. For testing, we have the link on the Templeton website where you can get testing. So that's easy to get back to. I'm sure everybody knows that the state has rolled back to phase 3, step 1. That reduces, again, the number of people who can sit together in a restaurant. It should be all household members. Outside events are reduced to 25. 50. Indoor events are 25. And it's all outlined at Mass DPH, but again, anybody who wants more information, I can email links with everything on it. There also seems to be some confusion between what isolation is and what quarantining is. So if you are positive for COVID-19 and you're exhibiting symptoms, isolation means that you are staying home, you are going nowhere, and you are not in contact with anyone in the household. If possible, you use a separate bathroom, you sleep in a separate room. It's a very strict thing. With a quarantine, depending on your exposure, do you have symptoms? If you don't have symptoms, you can be quarantined anywhere from 8 days to 14 days now with the changes through CDC. So, for example, if you tested positive but don't have any symptoms, you can test out again after the 7th day. If that comes back negative, you can be done. No symptoms, negative test, done with quarantine. If you had symptoms and by the 10th day you don't have any symptoms, again, you can test out and be done. They do think that the 14 days is more effective, but they're trying to keep people in their jobs and trying not to hurt too many people. I had some questions today about the report that I send out. And just to clarify, the numbers that I report, I look at the numbers daily, that the cases that we get from Maven. And Maven is the reporting agency through the state. What happens is I'm keeping track of quarantine dates and when people come off of 14 days. So my numbers are lower than what the state is reporting because the reporting hasn't caught up to itself. So in the first paragraph of the report that I put out, I still state that the state says we have 36 cases, even though we actually have 25. So I can understand where the confusion is, and I'll try and make it a little clearer the next time I do my report. Let's see. I don't know if anybody has any questions.
I kind of just basically have a comment, I guess, type of question.
Mm-hmm.
What I'm hearing is a lot of people are saying that they've gone for COVID testing and then they've returned to work or social or doing whatever they were doing prior to that. And then a day later, when they get the test, they find out that they're positive.
Mm-hmm.
And so because of the lag in testing as opposed to results, there's quite a few, and they're not around here. There are friends of mine, there are people that have gone situations and they said, oh, this person said they didn't have COVID when had tested, and it turned out they were, and infected a whole workplace because of the lag.
Wow.
So, and his family, and I mean, it was out of state. I had no contact with them whatsoever. It was on the phone. They just let us know that they had it and they weren't going to be around for a week. And 4 people in the house, all 4 of them had different symptoms and different degrees of the disease, or whatever you want to call it, the virus. So I found it interesting that they all had that. One of them had to get tested, and he went back to work saying, I'm waiting for my test. And the whole workplace had gone in saying we have to go get tested for COVID. And one person had it and got everybody sick. And then they got the results back and said, oh, this so-and-so had it, and now everybody's got it.
That's interesting, because from what I'm familiar with is if for some reason you've had exposure that causes you to go be tested, they're recommending that you immediately quarantine until you get your results back.
Well, this was in New Hampshire, and I don't know. I think I'm not sure if it was his workplace that said that all the employees had to go get tested for COVID. And between the time they said go get tested and by the time they got the results back, they all got it, and their families.
Wow.
I just thought it was interesting how quickly, and even though with the testing, it's not 100% foolproof.
No.
I don't want anybody to think that, I get tested, I don't have it, or I don't have symptoms. Because one of the kids, he had a headache for about 15 minutes and he felt fine. He was ready to go to school and do everything else on there.
Right.
You can't do anything. And he's like, hey, but I feel fine. So
there are people who have no symptoms but are positive. There are people who lose their sense of taste and smell and nothing else. It's a very strange thing.
Yeah.
Yeah, you can be tested and walk out of the site and contract it. So it's not.
Right.
I think that's what I was kind of saying is,
Yeah.
I was saying they're getting tested and they didn't have it, but until they get the results back, I mean, how do you really know?
You don't.
You don't.
Right. And that's why, and I know that at all the testing sites here, if you're going for a test, if there's a reason for the test, they're recommending that you quarantine until you get your test results back.
Yeah, I agree. I was just trying to get that point out there to people without articulating it.
You disappeared for a minute. Do you have any questions? Or
She can hear you.
I could hear you. The internet went out on my computer, so I had to go reset it. So
okay.
I didn't have any questions. Earl's points bringing that up is great because a lot of people aren't understanding that. And it's difficult to understand, I think, anyway. So,
well, it changes every single day. And when you think you've got a handle on how we're handling it, it changes again.
Exactly. And I know on the news tonight, they said we may be going back to phase 2. So more things will be closing.
Always a possibility.
Yes.
And
it sounded like it wasn't just a possibility that that's what's happening. But
yeah.
We'll find out soon enough.
I participate in the state calls every Tuesday and Friday, and that's usually when we find out what's coming up. Sometimes we find out when it's happening.
Yeah.
So,
Yep. It's been interesting. So, okay.
So I will continue to put the report out there. I will continue to get you the information. I know you and I have had a lot of contact. I'm in contact with Baldwinville Nursing Home. They're doing very well. They'll be getting vaccines shortly if they haven't already. The schools, I'm in constant everyday contact with the nurse director there. So, I mean, we try to close the circle. I would tell, I receive a lot of phone calls, but if you have questions, email me, call me, whatever you need to do.
Text you. Thank you for being so quick on those.
And that's really the points I had for tonight. I don't have anything else on COVID.
Okay. Anything else that you want to report to us?
As far as COVID goes?
Oh, as far as anything.
Oh, no.
No. All right. You've been there. You've been really busy looking at your reports that you've given us for everything that you've been doing, and having 8 perk tests is fun. And today was great weather. So I'm sure you were having a blast with that. So then
I'm yawning, and I didn't get as much. I was going back and forth to the site. So we had a lot of stuff in between. We're experiencing some heat housing issues. So we're working on those too, but everybody seems to be cooperating. So cross my fingers on that.
Anything going on with the house near Dunkin' Donuts?
That did not get picked up by anybody. Nobody bid on it. So
Okay.
that's still a work in progress. It
Okay.
has been properly secured by our DPW director and his crew. So it's at least keeping people from going into it. It is a work in progress. They haven't dropped it. It's just
Okay.
a matter
I just had
of,
noticed a few changes, so I was hoping that
Yeah.
maybe it was,
I
there was
was
something going on.
bummed that
Yeah.
nobody picked it up. What was the other? Let's see. We do have 21 South Main Street. That's gone into the receivership program, so that was awesome. That's all locked up, and they'll be cleaning up the yard there. There's a lot going on.
Yeah, there is. That's good, I guess. All right. So I guess we can move along. I don't really have anything to report
Okay.
other than that Lori's been a great help with any questions that we've had and keeping us informed. So thank you. Oops. Anything from Earl or Laura?
Nope.
Only that I signed all of the minutes and someone dropped them off today, as you know.
Thank you so much. I got those out there. So they're up on the My Town Government website where we schedule our meetings. And thank you to TCTV for working with us and rescheduling our meeting to an earlier date. And we'll talk about January and make sure that we have a clear date for that too. I'll work with Mr. Castle on that. And then I'll put a date out to you guys to make sure you're all set with it.
Great.
Sounds
Thank
good.
you. All right. We looked at the Board of Health activities already and the next meeting. I think that's it. And if anybody there's no questions on Facebook Live. YouTube Live, sorry. And we'll wait to hear from you, Lori, for the next meeting. And everybody enjoy Christmas in a safe way.
I should say one thing. One of the things that came out in the meetings with the state on vaccinations, when they are available, they're probably going to be doing, for smaller towns like Templeton and our surrounding areas, they're probably going to do regional clinics.
Okay.
So just to make people aware, they're relying heavily on places like CVS and the Walgreens to facilitate those. So just be watching if you're interested.
Yes. No, I've been waiting to hear where dental is included with the medical. They're supposed to be, but we haven't really heard anything. So
Yeah.
considering I have people coughing in my face all the time, I would kind of be like to know. So
You may be contacted by the closest, I forget where you work, what town?
Lunenburg.
Okay, so probably the closest hospital will be contacting the facilities.
Oh, good to know. Okay.
And that's all I can think of right now.
Yeah, we're all tired. Any other questions from anybody?
Nope.
Earl, comments, questions?
Motion to adjourn?
All right. I didn't even have to ask. All right. Earl made a motion to adjourn.
Seconded.
Laura seconded, and I am in favor of that. Again, everybody have a safe holiday.
You too.
Let's hope for 2021 to be better. So, all right. We'll wait to hear from you for the next meeting, Lori. And thank you, Mr. Castle and Hannah. Much appreciated.
All right.
All right. Good night.
Good night, all. Thank you.
Good night. Thank you.